Hello, you're very welcome to the choking risk training presented by the SLT department in Cheeverstown. So now I'm going to take you through how does it happen, but first we're just going to go through some terms that you might hear within your everyday practice. So following on from the dysphagia training that you've already completed, you'd be familiar with the term aspiration. So oftentimes colloquially you would hear people say that, something went against my breath, or it went down the wrong way. So aspiration would be the inhalation of food, drink or secretions into the lungs, and this can mean that food or drink has gone the wrong way and it's into a person's airway rather than going into their esophagus or food pipe. And the next term would be asphyxiation, which is when that material or bolus blocks the airway. And this would require a rapid intervention to prevent asphyxia, which can cause death. So the obstruction can be something edible, like food or fluid. It could be something non-edible, so coins, gloves, cotton wool, and it can completely or partially block the flow of air in and out of the airway. So if this happens, follow the procedures outlined to you on what to do in the event of choking and begin CPR if needed. And timing is really crucial. If the airway is blocked for too long, a person can die, as not enough oxygen is going to go to the rest of the body or the brain. The next term that we'll look at is choking. So choking is a process, and it's defined as an acute episode in which the patient coughed incessantly or experienced a colour change with an inability to talk or cough effectively whilst ingesting food or drink. The solid or liquid has to be expelled to terminate the event. So what that means is that it is a very sudden event where the person becomes acutely aware that their airway is being blocked, and the only way to prevent it or to stop it and to stop the event is to have that obstruction removed. And it's important to note that choking can happen to anyone at any time, and it can happen very suddenly. And so the other things to be aware of are that a person might cough, or they might make a weak sound, or they might make no sound at all. So they're really important to note. And then to stop a choking event, the obstruction needs to be removed. And a choking episode may be evidenced by overt or covert signs of choking. So this means there could be obvious signs that a person's choking. You might see somebody, they'll put their hand to their neck, or they'll look very frightened and look to you for help, or you'll see them making an effort to get up the obstruction and to expel it out, or the signs might be very subtle. And for some of the people that we'd work with who maybe have more profound communication difficulties, those signs might be very subtle that they are experiencing a choking event. So we talked a little bit just there about signs, that they can be obvious or they can be more subtle. So some of these signs are listed here from the Mayo Clinic. So one sign of choking would be the clutching of the throat. So this is a natural response to choking, to grab the throat with one or both hands. And they say it's a universal choking sign and a way of telling people around you that you are choking. You might be unable to talk. The person might have a panic expression, eye tearing, redness or strain. They might have difficulty breathing or noisy breathing or no sound at all. There might be squeaky sounds when they're trying to breathe. They might cough, which might sound weak or forceful. Their skin, their lips and nails might turn blue or dusky, and skin that is flushed and then turns pale or bluish in colour, and then loss of consciousness. But just to be aware that sometimes there's no clutching to the throat or any obvious signs that somebody is choking. A person might go very silent, and they might become very pale, and it might be more that you're seeing the body's response to a choking incident, rather than seeing anybody go to their neck or making attempts to move the bolus, or to move whatever is obstructing their airway. So this slide here is going to look at some of the risk factors for choking. So we are aware that any person at any time can experience a choking incident, but there are certain risk factors from the literature that would suggest that they would increase your likelihood of having a choking incident. And some of them are surprising, and some of them might not be as surprising. But we can just look at them here on this slide, and I'm going to start up at the top left hand corner under personal factors. So I suppose it's just to be aware of these risk factors that are there for choking and to understand them a bit better. So some of those personal factors would be needing support from others to eat or drink. So research would suggest that having somebody to assist you with eating and drinking is actually a risk factor for experiencing a choking event. The rate at which one eats, the pace at which one eats, and then the bolus size. If the bolus or the food piece, let's say, isn't fully broken down or isn't fully masticated in the oral stage and it moves into the pharyngeal stage, and it's too big, it can block the airway. So we'll move on then to some environmental factors. So over to the right. So some environmental factors would be distractibility, the timing of meals. Choking events were often found to happen more at tea time than the person's position. Time pressure during a meal. So needing a person to hurry, or back in the day when you had very set time limits for meal times and they finished at specific times, or if there's an activity that's going to happen straight after a meal, putting that time pressure on people was an environmental factor that can increase a risk for choking. Then if we move down to the bottom left, we're looking at drug factors. So people are more likely to choke if they're inebriated by, let's say, alcohol. And then also the effects of polypharmacy and psychotropic medication on the swallow, and how that can increase your likelihood to experience choking. And then the last one, just over there into diagnosis, if we look at there, would be that your age is going to be a factor, and going to be a risk factor for choking. And then any underlying medical conditions, and those conditions might be neurological, and it could be a physical and intellectual disability, or it could be a person who would need mental health support needs. So alongside those risk factors for choking, there are certain foods which are considered as high risk choking foods. And I'm just going to walk you through the textures here. So if you think about foods that are tough or fibrous, so for example, meats that are tough or dry, have a lot of gristle or fat, or foods like pineapple, celery, mange tout, and vegetable stalks. Long or round shapes, for example, whole grapes, cherries, tomatoes, olives, boiled sweets, sausages and hot dogs. Stringy kind of foods, for example, celery, lettuce and other raw salad or vegetable leaves. Those with skins or husks, for example, corn, peas, and then all fruit with skins or peels. Then chewy or sticky foods, so for example, sweets, peanut butter, cheese chunks, toffees, marshmallows, chewing gum and dried fruits. Some non-food items would be things like coins, pen tops, marbles, balloons, gloves, cotton wool and jewellery. Then some things like apples and hard pears. And if things are very crunchy as well, so popcorn, nuts, dry biscuits, toast, crackers and crisps. Foods that are very crumbly, dry cakes, muffins, biscuits and a crumble. And then foods that are mixed in consistencies. So this means that the solid food pieces are mixed with a liquid. So for example, fruit pieces mixed with yogurt, or cereals in milk. And thinking of your like cornflakes with your milk. Hard or dry foods, so for example, lumps of meat, nuts, bones, raw or undercooked vegetables, raw apple, hard fruits, pastry, pizza, hard bread rolls, bread with grains, hard crispy chips, roast potatoes, seeds, shredded wheat, hard edged pasta like in a pasta bake, and rashers, and they're all kind of considered high risk choking foods. So, as we are aware, choking is really serious, and we've just added in some stories about choking incidences just to kind of highlight how serious a choking incident can be. So, firstly, in the USA in March 2011, staff didn't adhere to guidelines that were provided and gave a person an incorrect food consistency, and that person died. And the cause of death was determined as asphyxiation as a result of choking. And there are similar cases across the America in residential facilities in different states following from 2009 until 2011, and unfortunately these cases continue to happen. In November 2015, an Australian woman with an ID received foods outside of the recommended texture. She had a sandwich and she was left unsupervised. And unfortunately, when they realised she was choking, they tried to support her and administered CPR, called the ambulance, and she was transferred to hospital, but then she unfortunately died. In the UK, there was a woman who had locked-in syndrome post a stroke and attempted the Love Island Marshmallow Challenge, and she asked for the marshmallows, and she died because of choking, and the court ruled the cause of death was due to choking. In June 2017, there was an Irish woman with an ID, and she received sweets at Christmas time, and she began to choke. The staff administered back slaps, abdominal thrusts, and delivered CPR, but again, unfortunately, she died 2 days later, and again, it was due to the choking. So how can you reduce a choking risk? So it's really important that you keep yourself up to date with training. So complete the dysphagia training that you've nearly completed this training, do CPR training, and do training on what to do if a person is choking, for people who are ambulant and for those who use a wheelchair, and ask the trainer as well, what would you do for a choke if somebody was to choke if they were very overweight, as well. And then also complete the risk assessment training provided by Jeeverstown. Read the mealtime plans, and if you have any questions, just ask. You need to read this really, really carefully, and please feel free to read it at every mealtime. And if you think that there needs to be any changes, or you're not sure about something, or you just have a question, please contact your manager and also the SLT department, so the speech and language therapy department. So don't give someone something outside their recommended guidelines, even if you know the person really well. So stick to the guidelines. If the person wants to receive texture outside of their mealtime plan or discuss their dysphagia management, again, contact speech and language therapy, and inform your manager. If you see a food that's not in line with the recommendations, or you're unsure if it's in line with the recommendations, ask the questions: why is this here and how can I change it? Offer an alternative within their recommended texture and contact SLT or your manager to discuss. It's really important that you know the food consistency that a person is meant to receive, and that the foods you are presenting that person with are in line with the recommendations. So be aware and avoid the risk factors for choking previously mentioned. Now, some of them you won't be able to avoid, like let's just say if somebody needs support with eating and drinking, and they have an underlying mental health support needs, they're an older person and they have a physical and intellectual disability. You're not going to be able to avoid all the risk factors, but things that you could do would be, keeping the environment calm, not rushing the person, maybe saying, like, reassuring the person that you've got plenty of time before you're going to do something that you enjoy, or like going to like a club, or going to something different, or a different activity. And then if you're not comfortable supporting somebody with eating and drinking, you need to speak with your manager, and we can link with your manager and support from an SLT perspective as well. Thank you so much for listening throughout this training. And if you have any questions, any concerns, any comments, please contact the SLT department. And if you want to read up or learn more about different aspects of choking, or anything, just let us know, and you can request these from the SLT department in Cheeverstown. Okay, thank you again.